Hey everyone, thanks for checking out this video. In no particular order, here are the top 5 ideas for week 1. Number 1 focuses on ways of knowing. So ways of knowing is at the heart of what we do as nurses because it's fundamental to the way we reason and make decisions. So there are many ways to acquire and use knowledge, whether it's something as simple as deciding what to eat or more complex as to how to handle an emerging clinical situation in practice. The focus of this course is about using science and the knowledge it produces as a way of knowing to inform nursing practice. However, to understand why we often rely on science to learn about things, we must first examine some of the basics about knowing. So there are lots of different frameworks out there available to help us understand the different ways that we come to know what we know. In the readings for this week by Campbell and colleagues, they highlight a broad level framework that categorizes knowledge as either propositional or non-propositional. So simply put, knowledge is either formal and explicit, resulting from research or scholarship, that's propositional, or it is informal and implicit and not intended necessarily for generalization. So that's non-propositional. Carper in 1978 further delineated these two categories to help us understand and articulate specifically 4 fundamental patterns of knowledge in nursing. So these are empirical, aesthetic, self-knowledge, and ethical. And Carper proposed that these patterns of knowledge are necessary if the diversity and scope of the nursing role is to be understood. Later on, Chin and Kramer added one more to that framework, one more way of knowing, focusing on social justice and human rights. And so while there are other frameworks out there, it's important to understand these 4. And in this course, again, we're going to focus specifically on empirical ways of knowing, understanding that all the different ways that we know come into play when we're talking about practice, and in particular, how we use knowledge in practice. Number 2, empirical knowledge or empirical knowing is based on research findings. So when we're talking about empirical knowledge, we're basically talking about what we learn from when we engage in research, various different kinds of research. And so what research does then is position nurses at the cutting edge of change and improvement in patient outcomes. So in today's world, if we want to make sure that we are using the best knowledge and making the best decisions, we have to think about empirical ways of knowing. And second to that, then we need to understand how research is conducted. Number 3 big idea, evidence-based practice. So this refers to the adoption by healthcare professionals of the tenets of what we call evidence-based medicine, which is what really started this off. Now, in your readings, you do read about the fact that the use of evidence and empirical evidence in particular has been around for quite some time. So nursing has been using it, medicine, other groups use it. An excellent example of our early foundations is Nightingale's use of experimentation and the knowledge that resulted from her observations to inform practice and make sure that she was able to help her patients to be able to attain health. In today's world, we owe a lot of what we know about evidence-based practice to the work that was done by several researchers in the area of medicine. So evidence-based medicine is the explicit and conscientious and judicious use of current best evidence in making decisions about the care of individual patients. So when we talk about evidence-based practice, we extend that concept in other professions, including nursing. Number 4, evidence-informed practice. We'll talk about this in another video focusing on evidence-informed practice, but very quickly, evidence-informed practice is basically the extension of evidence-based practice because it also acknowledges and encourages the consideration of many of the other factors that constitute other ways of knowing. So local ways of knowing, cultural ways of knowing. So that means evidence that should be incorporated is expert knowledge, clinical experience, patient preferences, and other resources. So when we talk about evidence-informed nursing practice, we're basically putting a nursing lens on this notion of evidence-informed practice. All right, last but not least, number 5, the nurse's role in research. So in your textbook, they talk about the evolution of nurses' role in research and going all the way back to Nightingale, who really was a pioneer ahead of her time in terms of how she used evidence that she generated from observations and to some extent experimentation to be able to apply that knowledge and mobilize it so that she could provide the best care for our patients. More than 100 years later, that's what we're doing now, and that's the emphasis of this course. So along the continuum, you have nurses who are involved in generating that knowledge, and on the other end, very far end, you have those nurses who are applying that knowledge. And depending on where you are in your career, you may fall somewhere on the ends of the spectrum or somewhere in the middle. This course really focuses on the consumer end of that spectrum, and it's really going to help you to be able to look at what evidence is available, appraise that evidence, and then begin to think about how you're going to apply it to your patient care. In the future, you may decide that you not only want to apply knowledge, but you also want to engage in it. And there's lots of different ways you can participate as a research participant. You can also work with a researcher, or you yourself can get the level of education you need to engage in and begin research studies all on your own. That's it for now. Check out the next video, and we'll talk to you soon.